All right, so I think I recognize Shayna and Valerie. You guys have seen me before, right?
Yes, we have.
All right, and I'm
You
hoping
did a pain class.
I
I, I,
did.
I remember.
Yeah.
Yeah.
Valerie, you're on mute. Steve, still on mute, Valerie. But it's okay. It's okay. Don't even worry about it. If you have questions though, I think what I wanted to do, especially since there aren't very many of us, we can kind of keep an open communication line if you want. So there you go. Try talking now, Valerie.
Well, I just wondered how you get rid of the pictures that the Shayna just asked about of all these ladies.
The PowerPoint picture
Yeah.
or the pictures of all of us staring at you?
No, the PowerPoint picture.
Oh, the PowerPoint. I'm going to go through it. I think
Oh,
you'll actually want to see it because
okay.
that's going to guide our discussion today.
Okay, thank you.
Okay, but since we're few in numbers, we can just maybe leave it on, and if you have a question or a comment, feel free to ask as I'm going along. I thought today would be a good day to talk about tendons and tendonitis and tendinopathies like you see on your screen. And the reason I thought it'd be a good idea today is because I've had a couple people come in recently that talked about shoulder pain, and they've had some issues going on with things related to like playing pickleball and some repetitive things. So I thought summertime we're a little more active. Maybe this is a good time for us to talk a little bit more about tendons and tendon health. So that's what we're gonna cover today. It is going to be based on pain, but we're going to focus on tendons. I'm going to adjust my screen just a little here. Okay, so I'm going to switch over and talk about what a tendon is. A tendon, I'm assuming everybody kind of knows what a tendon is, but the main emphasis of knowledge for a tendon is to know that it is your connection between a muscle and a bone. So the picture you see are the calf muscles, and this is one of the strongest and most dense tendons in the entire body. This is the Achilles tendon you're looking at, and it is a common source of injuries. But I wanted to make a couple points about them. One, a tendon obviously is its function is to deliver or distribute force between the active tissue, which is a muscle, and the bone, which is going to be the joint that's moved. So the tendon distributes that force to the bone so that the bone is moved. It is a very dense and fibrous tissue, so it's one that is difficult to tear but can be torn, and it certainly can be injured. Muscles are more commonly pulled. A tendon, it usually is inflamed, and that's what we're going to talk about is a tendonitis. So that'll lead us to our next slide. So this shows an elbow, and I kind of showed a number of different pictures. So we'll talk about inflammation and tendonitis in different areas of the body. This one here would be a tennis elbow, if you've heard of tennis elbow. And then there's golfer's elbow. But tendonitis in general is a term we use to describe inflammation of a tendon wherever it may be. And it is usually related to something we do repetitively. Sometimes that's keyboard typing. In cases that I've seen recently, there it's been pickleball and shoulder issues. It can be something related to running, climbing stairs, hiking. That's commonly known for the tendonitis of the Achilles tendon. Like we mentioned here, golfer's elbow, tennis elbow, and wrists and hands, ankles and feet. All the tendons of the body are subject to an inflammatory response depending on how we use them. So what I wanted to talk about then is, what is tendonitis? How does it occur? It can occur from these repetitive motions. It can also occur from a singular injury, sometimes a fall. A lot of people will fall on maybe their arm or their shoulder, and that will cause an inflammatory response and a tendonitis. And usually that stuff will go away, but sometimes it doesn't. So when I put on the slide, I put tendinosis and tendinopathy. Those are terms that we use to describe something that's more chronic, that's been going on for a longer time. A tendinitis is acute. Acute means it's in a stage of a few days, maybe a week or so. Once we get into about 2 weeks or so, we start thinking this is more of a chronic condition. We're going to treat it a little differently, and it creates other issues. Another thing I wanted to mention is that tendinitis, when it becomes chronic, can also cause problems with the surrounding tissues. So we think, oh, my elbow hurts in the case of the picture we see here. And the elbow is the problem at the tendinous junction, but the inflammation that's going on in the tendon will start to cause problems in the elbow joint if we don't take care of it. Same thing occurs with the shoulder, the Achilles tendon. So if something progresses to a long-term problem, then sometimes it's very difficult to treat just one issue. We start treating many issues. So that's something I wanted to bring up.
May I ask a question?
Yeah, yep, go ahead.
Is arthritis a part of are tendons affected by arthritis, or what might be a connection?
A good cause and effect question, actually. So a tendinitis, say for instance, my shoulder, I've been throwing a baseball with my kids and I'm starting to get a little inflammation in my shoulder. That inflammation eventually will maybe travel to the joint, and the joint, an inflammation of the joint is arthritis. So that's a cause and effect. A tendon is so close to a joint, it may cross over and cause an inflammation of the joint. That is arthritis. Again, the terminology changes when arthritis becomes a little longer term. We say arthritis. What we really should say is arthrosis. Arthrosis is long-term chronic issues. Arthritis is today, tomorrow, and for about a week, but it feels better after that. So that's just a terminology thing, but it definitely is very closely correlated.
Thank you.
Mm-hmm. So then I made this slide to talk about what inflammation is. Does anybody, maybe just by a quick raise of hand or nod, do you know what inflammation really is and what happens in the body?
Vaguely.
It's a pretty complex process, inflammation is. So the picture here kind of depicts some of the things that happen, and this is depicting skin. So say for instance, I scrape my knee. That's what this picture is showing you, but the same process occurs at a tendon or anywhere else in the body. So I have an injury or an insult to something, and the body responds in kind by first alerting itself to the problem. There's a problem, so we have an alert system. The alert system releases chemicals. Chemicals are released by these cells to alert the brain to pain. So once we experience pain, we know something's wrong and we're going to address it, or at least that's what we're supposed to do. So there's that, and then there's a recognition factor. And what I put here is, if you think about it like an emergency system, when you have something happen to the body calls 911. And when it dials 911, it sends out emergency departments. The police come, they open up space, and then they block the space off to avoid any other people or invaders to come in. And the fire department comes and puts out the flames immediately. And that's more like, so we have an insult or an injury. We open up, you can see it here, the red is a capillary. The capillary is carrying some of the cells from the blood. The capillary then becomes a little bit bigger. It opens up and allows for escaping particles and fluid. So as it does that, that's one of the responses. So now we're allowing something to come into the space and do something. That's where the fire department can come in and release some of the cells that help to block a bleed or to provide the first and most immediate assistance to help the body heal. Once that's done, then we have to have somebody come in and kind of clean up. And that's where neutrophils and macrophages come in. The neutrophils are blue and the macrophage here in the picture is purple. And they come in and they basically swallow up and destroy any foreign objects or invaders or problem substances, bacteria, things like that. That's their job. Once the site's clean and we've gotten rid of any foreign invaders, then it's time for rebuilding. And the rebuilding phase comes with the construction crews that come in and allow for new tissue to be laid. So when we scrape our knee, it's skin and maybe some of the deeper tissues to the first layer of the skin. But what's important about it is what kind of tissue it is that it lays down. And is inflammation a good thing? Is it good? Is it bad? We talk about inflammation usually in terms of negativity. So we're wondering, is inflammation a good thing or a bad thing? And that will lead us to the next slide. Do you have any questions on this one?
I do, Brian.
Go ahead.
I just wondered with this picture here, if you were taking the turmeric or the curcumin, would that show in here anywhere?
No, it wouldn't show in this picture per se, but the turmeric is supposed to be something that, and I couldn't explain it on a chemical level, but it does help to prevent chronic inflammation. This is more of an injury.
Oh, okay.
And in an injury, turmeric or even like your ibuprofens and stuff, ibuprofen may help. Part of an ibuprofen medication is to reduce the amount of chemical release that causes pain. So you may have part of the ibuprofen goes into this space that we're seeing and blocks the chemical messages to the brain suggesting that you should hurt.
Oh.
So you may have a little less pain, and the ibuprofen will result in a little bit of, I believe it's a reduction in the capillary expansion so that there isn't as much escapage of fluid and cells. It's a control mechanism. But and turmeric works in some of the same ways. However, that's more of we're treating chronic issues with those. In this case, we want the inflammation, and the body is going to inflame. We're not going to stop it. We just want to do something to control it. So that leads us back to that question. Is inflammation a good thing or is it a bad thing? Is it somewhere in between? So I'll lead to the next slide unless you have any other questions. Did I answer it well enough, Valerie?
Yes, thank you.
Okay. So is inflammation bad? And I put, well, that depends, right? We want inflammation. It is the only process the body has to heal. That's it. It's our only process to heal. So we go through these phases where we recognize, we mark, we get rid of foreign invaders, we clean up, and then we lay down new construction. And as we do it, if we do it right, the body heals and it functions very nicely. If we are not able to control inflammation, then it becomes more of a problem. So when we talk about arthritis or a tendinopathy or tendinosis, since we're talking about tendons today, when we're talking about those subjects, we're usually talking about something that's been going on for some time. And in that process, this cycle repeats itself. You have an issue, it's identified, you try to heal it, but then something happens, the problem, it reoccurs because maybe we're repeating the movement that was the problem in the first place. A good example would be a cut that keeps opening up, that doesn't heal. Well, now we got to restart the healing process again and again and again. And although the body will take care of itself, the more we do it, the more opportunities there are for scar tissue to lay down in a way we don't want it to. So that's what I was talking about here. You see the pictures. This is muscle tissue. And if you look at pre-injury muscle tissue, it looks very nice. It's red, and if you follow the grains, they lay down very nicely in an organized pattern. When an injury occurs, the injury site is infiltrated by fluid, which is swelling, right? Blood and cells. And all those things infiltrate the space. That's where you see in this picture, it says injured. That's what's happening there. But then in a healed space, you can see scar tissue doesn't look the same, does it? It's unorganized. It doesn't lay down as nicely, and the grains don't lay down in an organized pattern unless we help it. So we can help scar tissue lay down in a more organized fashion, but it takes the work of stretching and strengthening and sometimes some hands-on work from a therapist or something. So the point is, if scar tissue is likened to caulk and your body has an impairment or is injured, you can use caulk to fill in the gap or to heal the injury, right? But if the injury keeps recurring and you just lay down or squeeze a lot of caulk into the area and it dries, the chances are you're not going to be able to move in that space the same as you did before. Does that make sense?
It makes me wonder, is it better to put a Band-Aid on a wound or to let it be exposed to air?
Oh, that's a good question. It actually is good to put the bandage on because it helps to increase the clotting factors and get the wound to stop bleeding more quickly. But over time, having air, or you can dress a wound with different things, silvers and zincs and some things like that actually help a wound heal more quickly. Like a Neosporin, for example. Neosporin actually helps wounds to heal more quickly.
Yeah.
But it is good to actually expose it to some air. Yeah, you're right. We just want first to make sure that we help assist the clotting factor, and then Band-Aids are partially there to just not expose blood to other places or people. Any other questions on this particular slide here?
Nope.
So when I talk to patients about the chronic inflammation, I likened it to caulk here, but sometimes I'll talk about it like Elmer's glue. And I could just squeeze a bottle of Elmer's glue on top of a cut, and it would heal and it would dry and it would be able to close the gap. But if it's a huge glob of Elmer's glue, it sure isn't going to function very well. So a good example, my wife asked me to do some board and batten, if you know what that is, in the house. She wanted me to update the bathroom, and I had to use caulk between the boards that I nailed up onto the wall it was to give it a different look that she wanted. And I'm not a caulking genius or an expert, so I had to learn really quickly how to caulk correctly in the seams to make it look nice. And at first, I squeezed the tube and I got a lot of caulk out, and I had to figure out how to either remove it or to spread it out so that it would look a little better until I got it down. The body's kind of like that. You might put a whole glob of caulk in the space that you're trying to heal, and you can move it around while it's still drying, the scar tissue we're talking about. If you don't, it's just going to dry, and it may stick to other pieces of you that doesn't allow you to move and function as well. And that's really important when it comes to tendons and muscles and arthritis too. When it comes to arthritis, it will start causing bones to change. You get bone spurs and things like that. So those are all pieces of inflammation that occur in most of us for one reason or another. So this is the slide that just, what do I do? If I am trying to treat a tendon injury or a tendinitis, that most people have heard of RICE: rest, ice, compress, and elevate. But there is a P part to that, and that's to protect the injury. And a Band-Aid, actually, Shane, is a perfect way to apply the P. Protection. Mm-hmm. Protect from more foreign invaders, help the clotting factors, and keep it there until you know that your body's no longer exposed. But for a tendinitis, it's really important to rest. It is something that a lot of us have a hard time with because we usually get it from something that we're doing repeatedly. Maybe it's a hobby, it's a sport or something like that. But we don't want to stop. We want to keep doing whatever it is we're doing. So pickleball would be a great example. It's a nice out, and it's a great way to recreate and get some exercise in. And all of a sudden my shoulder starts to hurt, and somebody says, well, in order for your shoulder to heal, you've got to stop playing. but I was enjoying myself. So a lot of people have a hard time with the rest component. Ice is important, and ice is a very nice way to control inflammation. It does not stop inflammation. But remember how I talked about a capillary is going to open up and expand? Ice closes it off so that it can't open up and become porous, and you won't have as much fluid escape or cells. It's a control
That's
mechanism.
the seminar.
And then the other thing about icing is a cold factor helps to control pain. The brain recognizes first the temperature gradient and then pain, so you can help reduce or alleviate the pain you're experiencing from an inflammation. Compression is important depending on the location, but it does help to keep fluid from sitting and pooling in spaces. And then elevating is to return some of the fluid or swelling back through the cardiovascular system so that it doesn't pool or sit in spaces also. Any questions on those? Okay. I'm gonna move on. Here's my plug. I'm shameless. So what happens if it doesn't heal or go away? That's where somebody else comes in. And physical therapists are obviously one of the primary helpers in the medical or the healthcare system with tendinopathies, tendinitis, muscle and bone injuries, and things like that. A physician comes in and can do injections, inject steroids, or give medications to help with pain. Steroids are a heavy dose medication that will help to reduce or eliminate swelling or inflammation. And they're usually used if it's more of a chronic problem, because you don't want to inject something that is trying to heal on its own and hasn't had a chance to yet. And there are a couple other things that they can do. Obviously, surgery ends up coming into play sometimes. But for the most part, if it's a simple issue, physical therapy is actually a really good solution. So the question is, well, how? What do we do? So if somebody comes in for physical therapy, there's a couple things that are really important. One of them is body mechanics, posture, how you sit or stand. If you're playing pickleball, how is it that you position yourself when you swing your arm to hit the ball? If you get a little inflammation, tendinitis from typing, where does the computer sit? How do you sit or position the computer screen? Where do you position your hands? All those things matter. If it's a tendinitis of like a knee, then sometimes it's important to know, how does somebody get up and down from a chair, and are they doing that with the right mechanics? So that's something, I guess you'd call a physical therapist in some ways a body, quote unquote, mechanic. But that's what we do. We'll look at the mechanics of somebody's movement. We'll look at how they set themselves up, and we'll try to correct those things so that when you're doing whatever it is, that you do it from a better position. And then it hopefully will take away the root cause of the inflammation. But then we're going to look at how to mobilize the tissue. That can be massaging, or sometimes we use like ultrasounds. Electrical stimulation can help with pain and sometimes help to mobilize healing cells to the area we want. Stretching lightly is important with any sort of tendinitis or tendinopathy, and the correct way to stretch without overstressing a tendon is really important. And then strengthening is significant, and there's very specific ways to strengthen a tendon to make a tendon feel better and heal. And that's something like in our case, a physical therapist knows exactly how to strengthen something so that you heal. Any questions on those things?
No.
Okay. 9.5 minutes. Do you have any questions overall that I can answer?
You know, I was going back a couple of slides ago.
Mm-hmm.
I just caught at the end something you said about not, yeah, there it is, not sleeping with something that compresses.
So
Is that does that include something like those tubey grips? You know, it's just a light stretch that helps your knee. I'm thinking particularly of the knee. Sometimes I sleep with it at night.
Oh,
It's
totally okay.
soft. It's a soft, like a soft sock, but it has
Yeah,
some
no,
compression.
you can sleep with compression. There's nothing wrong with sleeping with compression. The only thing that you really want to factor in is whether or not you can feel your toes. Otherwise you're fine. If you can't
Oh,
feel your
'cause-
toes, or if you were to pinch your toenail and you couldn't see the pink return in the toenail, like the blood flow return,
Yeah.
then it's too much.
Okay,
And
so that,
it's becoming more of a oh, what do you call it? I'm forgetting the term. You're cutting off your circulation.
so that last sentence under compress,
Uh-huh.
is don't leave the bandage on while you sleep.
If you put it too tight, that would be absolutely correct. But if it's a light compression, it won't hurt anything. And
Okay,
granted, usually when you sleep though, you don't necessarily need compression because you're not weight bearing and you're not upright. So
yeah,
your body is better able to pump the fluid and swelling back up and out towards your heart. So while it's not necessarily something dangerous, it's not something necessary. And I think most people would compress at night because it feels better.
it does, and that it feels better in the morning
Yeah.
when I get
Right.
up.
Nothing wrong with it. Nothing wrong with it.
Okay,
It would
thank
be
you.
it would be a problem only if you couldn't feel your toes or feel your feet or you didn't have the blood return.
Yeah,
But as
no,
long as your blood vessels are able to carry and distribute blood and oxygen to all the tissues of the body, you could compress as long as you wanted to.
okay, thank you.
Mhm. Any other questions? Okay. Well, hopefully, I mean, this is pretty simple, but hopefully it's helpful. And if you or anybody, any of your neighbors or residents seem to come across something like this, maybe you can refer them to the slides. I assume they'll be posted, right, Amy?
That's radio.
Yeah. So they'll be available. And then if anybody has any questions that you didn't think of now, my email's right there, or Amy knows how to get a hold of me, or I have cards downstairs in the fitness room with Mike and Reggie. Okay.
Okay, thank you very much.
You're welcome.
Thank you.
Everybody have a wonderful day.
Thank
Thanks.
you, Brian. Great job. Thank you.
You bet. We'll
Bye
talk to you guys later.
Bye.
Bye.